Hi, I'm Bob Beall, and I'm President and CEO of the Cystic Fibrosis Foundation, and I have the pleasure today of participating in this video with Dr. Bonnie Ramsey, Professor of Pediatrics at the University of Washington and Seattle Children's Hospital. And Bonnie has been a director of our Therapeutics Development Network. She has been chairman of our center committee. She has done everything the foundation has asked of her to do over the years, but most important for the people that are out there viewing this, she has played a significant role in the development of almost every major therapy that we have for cystic fibrosis developed over the last 25 years or so. Pulmozyme, Toby, Kalydeco, all have been part of her efforts in making sure that we develop new effective therapies for cystic fibrosis. And one of the things I wanted to ask you is if a newly diagnosed family comes in today, as opposed to 1983, what do you tell them that's different about this disease today than it was 30 years ago?
1983, I would say your child has a life-shortening disease, but we're here to support you. It was really support. And now I say, this is still a serious disease, and we're going to have to work together on this. But I expect your child to grow up and reach whatever dreams he or she has, and we're here to make that happen. It's a completely different message.
So Bonnie, obviously lots happening in cystic fibrosis today. I mean, we're looking at CFTR modulation, we're looking at new antibiotics, new anti-inflammatory. You know, we've doubled our medical budget in the last few years. Our CF Foundation is going to be spending over $130 million this coming year in research. What are you really most excited about?
I'm excited about just the hope that we can give the families. It is so different. I mean, I talked a while ago about a new diagnosis, but even a patient I followed, as I go in the door, I think, now, what study could this family potentially be on that may impact them? And so I go in and the families go, so is there something that we can be working on? And for 90% of them, there is some study that I say either is open now or will be open in 6 months. And it just brings so much hope. And my long-term hope is that I can walk in the room like I do with my patients with G551D and say, now we can give you a drug that is really going to change your life. And I would want that for 100% of my patients.
We often use the concept of a roadmap. And I think that it's not going to be, point A to point B. There's going to be some curves in the road. Kalydeco was an amazing proof of concept. But Bonnie, I want to make sure we go back to the other part of what we do. It's just not CFTR modulation. Right. It's to treat and look at new therapies through the entire process where we can intervene in the disease process, whether it's new anti-inflammatories and whether it's new anti-infectives.
It's very important to know that there are more antibiotic, anti-infective studies going on now than we've ever had. I mean, so that has not slowed down at all. We not only have these CFTR modulator studies, but we have anti-infectives, anti-inflammatories, treatments that help clear the airways, and nutritional studies. And it takes patience to complete these trials. If we don't have the trials completed, we don't ever have the drugs approved by the FDA. The CF community as a whole has been very supportive of clinical trials, and I really want to thank every family and patient who has participated, because it takes time and energy. And right now, we're about to ramp up even more in the coming year. We need everybody's help. We need everybody to go to cff.org, look at the studies and say, which one of these might be interesting to me? Go and ask your doctor, how could I participate in a trial? And, if it's not right for you today, maybe in a month or two, it would be better for you. We need to be able to enroll all these studies so that we can get these new drugs.
What have you learned from your patients?
I've learned what's important in life. I have gained so much more from my patients than I could ever give to them. No matter what news I have to give patients, they always say, we can do better. And my biggest joy when the Kaleido came out was talking to some of my adult patients that I hadn't seen in years who called me up just to say, this has changed my life. That, I can't explain to you how much that meant to me. They really have put my life in perspective.